Rashes on your baby is giving you a critical message that you have to change the nutrition of the baby if you want him or her to be happy and healthy. Or otherwise, you face many dreadful and sickly things that will bother your baby seemingly out of the blue, like a bad spell seems casted on you. Lean in, this is a big one I need to share with you. This is vital knowledge. I'm Dr. Chris, MD, helping mums to be happy and raise healthy, happy babies. Now, as a family physician, I've delivered more than 1,000 babies like yours, and I've coached tens of thousands of mums just like you with their newborns. So, Cradle Cap, also called baby dandruff, is crusty or oily, scaly patches on the baby's scalp. This skin condition got its name because the most common place for the scaly patches to show up is on the head, where a baby would normally wear a cap. So, this condition isn't painful or itchy, no, but it can cause thick white or yellow scales that sort of spread and aren't easy to remove. It is part of a condition doctors call seborrheic dermatitis. Now, what does this mouthful of Latin mean? Coming from the word sebum is grease and rhea is excessive or undesired discharge. Now, thus it refers to an excessive fatty, oily secretion from the tiny greasy glands of the baby's skin, which is more concentrated in certain areas of the body like the face, the back and neck, the ears, and the shoulders, exactly called acne in adults. And dermatitis comes from the derma, which is skin, and itis is inflammation or irritation. So, when us doctors don't know the cause of things, we merely throw exactly what you said back to you in Latin, and it sounds very authentic. Yet everybody buys into this, and that's why we get paid for the big bucks. With all due respect, of course, I'm just speaking for myself. Okay, so common signs of cradle cap include babies can develop seborrheic dermatitis when they're between 2 weeks and 12 months old. They can have greasy, patchy scalp. The skin on the scalp, it may also look oily or greasy. And they may have white or yellow patches of scales on their scalp. Over time, the scales may flake off, but the main rash still remains. So possibly there's slight redness or there's changes in the scalp color. Sometimes the skin on the baby's scalp may look a little different color rather than scaly or flaky, just this discoloration. So, cradle cap doesn't feel itchy to your baby, and although it looks like it might be, there's also hair loss. That's rare, but a baby may lose some hair where they have cradle cap because it's irritating the skin which contain the hair. Now the hair should grow back after the cradle cap goes away, no worries. So cradle cap on other parts of the body, aside from the head, scales can also show up in the face, the eyebrows, behind the ears, or the armpits, or in the diaper area. So don't stress, cradle cap, it isn't contagious and it's not caused by poor hygiene. It usually starts with cradle cap on the head, and a baby with cradle cap will have slightly red, scaly or rough, crusty yellow patches on the scalp, and then it may also start on the face or the diaper area and spread to other parts of the body. No, this is not good, we don't want this. Please subscribe and click like if you're getting value from this video. In the algorithm, then YouTube will show this valuable information to more people. Cradle cap and seborrheic dermatitis in infants, more often than not, clears up on its own in weeks or months. In the meantime, you may be kind of itching to loosen and remove those little scales on your baby's scalp, pun intended. So, your doctor classically may tell you the following. Wash your baby's hair once a day with mild, tear-free, unscented baby shampoo. And also, gently remove the scales with a soft brush or a toothbrush. And if the scales don't loosen easily, apply a small amount of baby oil or petroleum jelly to your baby's scalp to soften the scabs overnight if needed, and then use a little net comb or a gentle brush to brush it out and remove the scales. Then shampoo your baby's hair normally in the morning. Now, I don't know about you, but let's have some natural solution here addressing the root cause. You know, there is a strong association of malassezia, it's the name of a yeast or a bad germ overgrowth on the skin, and in the inflammatory reaction to its presence on the skin. So that's like a theory, but we know if we kill that germ, things go better. So we can use essential oils, tea tree and borage, They are used successfully by many, and it comes even in a 5% tea tree shampoo also. Also very effective in soothing essential oils like cedar oil, lemongrass, rosemary, and lavender oil. You can even mix these oils in a mild sulfate-free shampoo, or with something Babu Botanicals. You can make things, that's the thing you mix it in. You can make things easy and use a shampoo that already contains the goodness of tea tree oil. Aloe vera is a complex spiky cactus that grows wild here in Africa, where I come from, and it has miraculous antifungal and wound healing properties for the skin. I'll put some of these links in the description below so you can maybe acquire those. Now, breastfeeding mums and or babies should go on a gluten-free, cow dairy-free, sugar-free diet. You will be amazed within a few days. This instigates this whole skin reaction. The body's throwing out things that it doesn't want inside. Now, to improve the microbiomes, the community of microorganisms that live in harmony on a human body or the skin, by increasing the probiotics or the good germs of the skin, you can wipe Cradle Cap 3 times a day with apple cider vinegar, the mother one, which is the original one, with the live germs, diluted 1-in-1 with clean water. Now, there is now a company that makes special probiotic drops to normalize the skin. See the link in the description below as well, or message me. You will probably not believe what our ancestors did for Cradle Cap. Hold on, let me tell you. Every time they changed a wet pea cloth, you know, those old cloth diapers in the old days, they would just wipe the urine over the baby's cradle cap, over the head, and it would clear it up in no time. So it's so effective that a natural hack still today is that they manufacture 10 to 20% urea cream, especially for this. I've had very good results with this. Here's my big hack to recover for good and be a happy mum raising a happy, healthy baby. Our bodies have like 7 channels of elimination. So which are those avenues through which it gets rid of toxins and bad stuff from out of the body, from inside out. Okay, dumping it. Now the gut, the bladder, the liver, the lymph, the blood, the lungs, and last but not least, the skin is the big one. What really is happening with seborrheic dermatitis in a baby, same as in a teenager with acne, is that their body is dumping toxic fats and foods or milk, as well as inflammatory foods out of the body through the skin. Now, the toxic fats are trans fats, hydrogenated oils, and animal fats through the dairy from the cows, either through food or through the breast milk as mum ingests it in her diet, or formula made from cow's milk as a base. Then it goes over to the baby. Now, the inflammation of the skin also comes from inflammatory foods in baby's diet or in mum's diet through breast milk. So these foods are gluten, sugar, dairy, and all animal meats that are fed toxic stuff all their lives to fatten them so they can sell them to us. Now this ends up in their bodies, and then our bodies, when we eat them, and eventually indirectly through your breast milk, you'll be so amazed what happens if you and your baby go like whole food vegan for a month. It is super healthy and nutritious and handles the root cause right on the spot. So also, of course, whole food means vegetables and fruits that you hold in your hand and can chop it up and prepare. Cook it lightly and gently and eat it. Nothing in jars with labels and sauces and strong spices, okay? That means they tampered with it if there's a label on it. Now that's of course the requirement in the food industry, but we don't need that stuff in our bodies, or we get all these things on the skin. Now the functional medicine approach to eczema involves identifying and managing the underlying cause rather than just the symptoms. So the first step is to eliminate or identify trigger factors. This involves getting a thorough understanding of your case history, and then when necessary doing additional allergy and sensitivity testing. This is for stubborn cases. Your practitioner can also give advice on bathing practices and natural skin treatments that will help. Now, if food is a potential trigger, this can be detected using an elimination diet. Just don't eat the food and the condition will go away. And I've told you which ones those are. But we already know what they are, of course. Your functional medicine practitioner can then give you advice on how to avoid the problematic food and what to eat instead. Now, there's a lot of research linking imbalance in the digestive system with eczema. Symptoms such as bloating, gas, abdominal discomfort, and reactions to food can indicate an underlying problem exactly with food, you see. Functional testing can help to pinpoint the cause so the problem can be addressed. So, eczema is also related to disparities in the way the body metabolizes certain fats. Now the bad modified fats, we call them Frankenfats, like man-made toxic altered fats, just like the old Frankenstein monster was. This leads to a tendency towards inflammation. Now, supporting fatty acid metabolism and redressing the balance of these fats with diet and supplements, you can calm eczema easily. So trans fats means they transform the fats, and hydrogenated is they hydrogize it so that it's a different oil. Functional medicine can also work directly on the inflammation of the body using food and supplements. In eczema, there's a tendency for the immune system to behave in a more inflammatory way than normal. So specific foods, herbs, and supplements can help to temper this, while the inflammatory and processed foods worsen it. Now the bottom line, and for optimal health and for you and your baby, a small price to pay this is eat whole food, vegan for at least 2 weeks and see for yourself. And stop gluten, sugar, dairy, animal flesh, nothing with eyes and ears and that has a mama, and no processed foods in jars or packages with barcode labels on it. Do it for at least 2 weeks and you'll see for yourself, and let me know please, and I will show you some more astounding videos. So how are you enjoying your baby? Do you have any challenges, other challenges? Comment below and I'll make more videos. Just tell me what you'd like to see. Okay, this is Dr. Chris signing off. Ciao mamas, thank you for watching.